Food does not only provide nourishment. Indeed, since the earliest times, it has also been considered as founding element of medicine. Just look, for example, at the Chinese ideogram Yi, which means medicine. It is made up of two parts. The upper one represents a sick man, while the lower means wine. However, not only the Chinese were famous for their knowledge in this field. During the centuries, people from all over the world discovered the properties of food. Now we'll analyze some of them which are still important for our society.
If I asked you, how did the ancients use red wine? You would probably imagine drunk people in a toga celebrating the Bacchanalia. However, we won't talk about this now. We know that wine was very important even in the traditional Arabian medicine, despite the prohibition in the Quran. Egyptians used it as a local anesthetic, while Etruscans applied it on wounds together with cabbage. But what makes wine so special for health? Its benefits are mainly caused by the presence of antioxidants.
Oxidation is the process in which a compound loses electrons that are then acquired by another molecule. Antioxidants interrupt this process and eliminate the presence of free radicals in cells. In this way, they reduce DNA damages and decrease the possibility of getting cancer, cardiovascular, and neurologic diseases.
Anthocyanins come from the gate pills. However, we do not get the same benefits as by eating the fruit, since these molecules are bound to sugar. They perform an antibacterial task, combining with the proteins responsible for bacterial reproduction. In traditional medicine, anthocyanins have been used to treat many diseases: fever, liver diseases, arterial hypertension, dysentery, diarrhea, infections, and cold. And they have been proven able to reduce the fragility and permeability of capillaries, favoring circulation.
Tannins' properties come from their ability to bind tenaciously to the proteins that are in epithelial cells. This process protects intestinal villi from irritating substances and from microorganisms.
Resveratrol can improve cellular efficiency, increasing the activity of mitochondria, energy units which are in cells. Some researches on animals seem to demonstrate that it supports longevity and reduces risks of damages of mitochondrial DNA. Beyond this natural remedy of wine, there are medicines which attend mitochondrial illnesses. Nowadays, however, determinate therapies don't exist. These drugs, if assumed in very great quantities, can cause side effects such as allergic reactions, fatigue, headache, and sleep disorders.
After having mentioned all these benefits, we have to say that this doesn't mean we should get drunk every day. Indeed, the abuse of alcoholic drinks can lead to deficiency of water-soluble vitamins as thiamine, also known as vitamin B1. Moreover, it is important to say that in the Mediterranean diet, not only wine contains antioxidants. Indeed, there is also an important condiment that we should talk about.
Olive oil was a precious product in our history. Think that in the 6th century BC, Solon, one of the 7 sages, declared that the person who cut an olive tree would be condemned to death. The Greeks used it both as a cosmetic and a medicine, for example in the healing of a thief's wounds. The Romans, on the other hand, used pressed olive leaves for red eyes or olive oil to treat burns and swellings. But what makes this plant so special?
These antioxidant molecules are responsible for the fruity taste of oil. Recently, they have been highly revealed thanks to their antioxidant properties, and indeed, they fight free radicals, which can cause tumors and other diseases, and reduce the bad cholesterol LDL, which causes heart attacks.
In addition to this, extra virgin olive oil contains unsaturated fatty acids, in particular oleic acid, which we can say is the guardian of arteries, since it binds to LDL and drags it away. It is also able to heighten HDL or good cholesterol levels, and it simplifies the transport of A, D, K, and E liposoluble vitamins into oil.
Moreover, this condiment has anti-inflammatory properties and provides some essential fatty acids that our organism can synthesize by itself. The Mediterranean diet, where olive oil is the main source of fats, has endless positive effects. Sure enough, if we replaced at least 5% of the total amount of the calories given by saturated fats with olive oil, we'd notice a significant reduction of the risk of many tumors. But its positive effects don't end up here. They involve the whole body.
Oleic acid has the same effects also on the nervous system. It protects us from Parkinson and Alzheimer. Indeed, those diseases are caused by the excess of free radicals, which bind to essential parts of the nervous cell, so that they change their structure and foster their deterioration.
Oleic acid contrasts chlorhydric acid to protect mucosa from gastritis and ulcers.
In diabetic patients, it reduces insulin resistance and reduces the sugar level in the blood.
It fights arthrosis and osteoporosis.
It has an antioxidant action against solar radiations, protecting skin from tumors and skin diseases.
Even during pregnancy, it stimulates bone mineralization and prevents the baby from bleedings. Anyway, oil is not the only source of polyphenols. Of particular interest are polyphenols derived from cocoa, green tea, and apples.
In Aztec culture, cocoa was so highly prized for its medicinal and stimulant value, but it was different from today's, since it was sugar and milk-free. The polyphenols in dark chocolate are associated with lower blood pressure, low risk of cancer, and with improvements in important markers for diabetes. Moreover, cocoa provides us magnesium, which is fundamental for teeth and bones, and has an anti-stress effect.
Green tea polyphenols have been shown to possess multiple effects. Other benefits include increase in metabolic rate, a boost of the immune system and mental alertness, and an anti-stress effect. A recent study showed that drinking more green tea is linked to lower death rates from all causes, in particular cardiovascular diseases.
Yes, an apple a day keeps the doctor away. In fact, just an apple contains about 20% of the daily recommended quantity of fibers, which help to keep the cholesterol level low. Studies show that the anti-inflammatory and antioxidant properties of apple polyphenols have a wide range of health benefits. Population studies have linked increased consumption of apples with low risks of some cancers, cardiovascular disease, asthma, and diabetes.
Talking about cardiovascular diseases, we should not consider only cocoa, tea, apples, and wine, but also... Your grandma will never forget that disgusting oily fluid she had to take when she was a child. Yes, you're right, we are talking about cod liver oil. The reason for the actual popularity of fish oil dates back to the 70s. Studying the habits of Greenland Eskimos, researchers surprisingly observed that in spite of their extremely high-fat diet, incidence of cardiovascular diseases was very low. They concluded that the real reason for this was a high concentration of particular molecules called omega-3.
Omega-3 and omega-6 are essential fatty acids, since our organism can produce them on its own. In particular, starting from alpha-linoleic acid, an omega-3, and linoleic acid, an omega-6, our organism can produce all the others. So, we should combine these molecules in our diet with nuts, cereal, and vegetable oils. However, the main source is fish, especially sardines, mackerel, and salmon.
But what is the difference between omega-3 and omega-6? It is in their structure. As you can see, counting from the end of the molecule, in omega-3, the last double bond involves the third atom of carbon, while in omega-6, it involves the sixth. This difference is fundamental. For a healthy lifestyle, we need a balance between omega-3 and omega-6. This proportion should be 1 to 5. However, in our diet the effective proportion is 1 to 15. This happens because of the big quantity of meat and sunflower and corn oil we take.
Omega-3 perform very important tasks in our body. They constitute the phospholipids our cell membrane is made of. In particular, they are responsible for their fluidity. They are the precursors of important anti-inflammatory molecules, called eicosanoids.
Last but not least, they contribute to the normal cardiac functions. Indeed, 1 gram of omega-3 per day reduces the quantity of bad cholesterol LDL in favor of the good HDL. This function is carried out also by some drug treatments. However, most of them have side effects. Actually, they usually contain statins that block the liver enzyme responsible for the production of cholesterol, leading to serious problems such as liver damage and muscular problems. In this case, drugs can be replaced with omega-3, in particular EPA and DHA. In fact, they protect the anterior surface of blood vessels, preventing the formation of plaques that cause atherosclerosis.
After having spoken about molecules, food, and drunk people, we want to underline this double purpose, recalling the importance of food as the main medicine, which can sometimes substitute drug treatments. As the Greek doctor Hippocrates said,
medicine started when people could distinguish the sick person's diet from the healthy ones.